Yes sir, this particular structure is the sartorius muscle. So it is coming from here, that is the anterior superior iliac spine, and it will go and get inserted with relation to the medial aspect of the tibia. So this particular muscle that we are finding here is the sartorius muscle. So this region is present lateral to it. This portion was medial to it. So this is your femoral triangle, and these portions are basically present lateral to it. So when we are talking about the lateral aspect, this superficial most muscle that we are finding, so this is the rectus femoris. This is coming from the anterior inferior iliac spine, and sartorius was coming from the anterior superior iliac spine. Now, if this is the rectus femoris, medial to this is the vastus medialis. Lateral to it here is the vastus lateralis. If we lift this particular rectus femoris, then underneath the rectus femoris we find another muscle. So this is referred to as the vastus intermedius. So the four quadriceps, rectus femoris, vastus medialis, vastus lateralis, and underneath this one is the vastus intermedius. Now if we go to the medial aspect of the sartorius and we follow the medial border of the sartorius, and then the medial border of this muscle, which is referred to as the adductor longus. So this is the adductor longus, this is the sartorius, and they have an apex. They are meeting, joining. So this is the apex of the femoral triangle, bounded by medial margin of the adductor longus and medial margin of the sartorius. So these are the primary contents inside this femoral triangle, of which the first structure is a very superficial structure. This one is the great saphenous vein, and if we trace this we will find that this is draining into this structure. So this particular structure is the femoral vein. This particular structure is the femoral vein. This one is the femoral vein. This is the GSV draining into the femoral vein. Lateral to the femoral vein, this structure is the femoral artery. So this goes like this inside the continuum. Now lateral to this femoral artery, you can see that there is a massive branch, right? This is basically the branch. So this particular branch that is present lateral to the femoral artery is the profunda femoris. The profunda femoris here gives off a branch which is known as the lateral circumflex femoral. This lateral circumflex femoral will be related with a very important structure here which is known as the femoral nerve. So this is the femoral nerve, and this femoral nerve is divided by the lateral circumflex femoral into a posterior division, because these particular nerves are present posterior to the lateral circumflex femoral artery. So these blood vessels, they are at a deeper plane and they are on the posterior aspect. So they are the posterior division. Now this is sartorius, and if you just lift the sartorius a bit, you are now able to see this particular nerve which is entering inside the sartorius muscle. So this particular one is a branch to the sartorius, and we know nerve to sartorius is a branch from the anterior division. So definitely this is the circumflex femoral, and this particular nerve is present anterior to it, thereby making the nerve to sartorius a branch that is coming from the anterior divisions. This was our inguinal ligament, the base, and here we have got the apex. Now if we move towards the apex, here there are a few superficial branches of the femoral artery. So this is the femoral artery, right? So